Hi, everyone. I'm Amna. I'm one of the PGY4 chiefs at Hopkins. I'm joined by Komal and Melissa. They're also the chiefs at Hopkins. We're here for PM&R at our institution. Feel free to ask any questions about anything that we present. So going into the presentation, um, our residency program is been around for a while. It's been expanding. So currently we have 24 residents, 8 per class. Dr. Freelander is our program director. She's incredible. Many of us would say that she's one of the most supportive program directors, as well as Dr. Engel. She's our assistant program director. The current interim chair is Dr. Gonzalez. And in terms of just where we're located in Baltimore and Maryland. And we also rotate and go around some of the surrounding area in Maryland. Our program highlights include just having a great supportive environment, a lot of supportive faculty, but a lot of flexibility as well in terms of what we're able to do during our residency. And we also have a lot of fellowships available at our own home institution, as well as the opportunity to rotate at others. Um, and just add this little thing about there's a Golden Goniometer Award where we kind of highlight faculty that have been great at teaching. Dr. Freelander, our program director, was nominated and won from us residents, which shows that we really do have a pretty good supportive faculty that's consistently all the residents do tend to agree with. So let's learn a little bit more about our program. So these are some pictures from events. These are our residents. The top left is when we have the meet and greet initially when the PGY2s come in. On the right is when we went for adaptive rock climbing. The bottom left is the Orioles game, and the bottom right is graduation. So while we have a big class, everyone does tend to get together, and we also do have a lot of experiences outside of work where we all get to hang out. So living in Baltimore, it's a very up and coming city. It has a lot of young professionals. The places that a lot of people tend to live in is Inner Harbor or Harbor East, Fells Point, Canton, and Fed Hill. There's a lot of things to do, hiking, breweries, professional sports, the Orioles and Ravens, sports leagues for recreational. There's Volo, which is there's pickleball, there's volleyball, a lot of sports that people like to participate in the area. I think this year we're trying to get a pickleball group within the residents. There's a lot of restaurants, cafes, museums, music, more. There's the symphony orchestra that's nearby. There's DC that's nearby. People can go to a lot of concerts and events there. Um, we sometimes try to do group activities outside of work as well. That's just a picture of the Inner Harbor area. It's really nice during the winter time, summertime. There's a lot to do there. So going into our rotation sites, we have many different locations, but our two primary locations are Johns Hopkins Hospital, which is in East Baltimore, which is where you can see the JHH line and logo. It might be a little hard to see exactly where it's pointing to, but it's towards the center of Baltimore. And then we have Bayview, where you can see the BVM, Bayview Medical Center. That's the other hospital that we rotate at. Those are the two main sites. In addition to that, we go to University of Maryland's Rehabilitation and Orthopedic Institute. That's where we do spinal cord injury and traumatic brain injury rotations. We see a lot of the patients that come from their shock trauma program. And then additionally, Kennedy Krieger, which is primarily for pediatric rehabilitation. We do inpatient pediatric rehabilitation and outpatient peds there. Future Care at Canton Harbor, that's kind of in that same Inner Harbor area, Canton area. That's for our subacute rehab rotation. Then there's a bunch of clinics that are around the area, Howard County, Green Spring Station, White Marsh, and Columbia. These are a little bit further out north and south. So I would say the furthest out would be about 30 minutes by car. So preferably needing something to drive around, transportation. Some residents do find other ways to get around, whether it's through the metro, whether it's through biking. There's a shuttle that's available to help with transportation, but primarily getting to and from some of these clinic sites. They're not as frequent, but it is preferred to have some mode of transportation at your disposal. So a sample PGY2 schedule for our second year, we have a very heavy inpatient. I think most programs are like that. And then towards the third and fourth year is when there's a lot more outpatient rotations. We start on Meyer 7 or Bayview. You can start in the clinics as well, but for ACIR at Meyer 7, we see a lot of complex and unusual cases there. So you'll have stroke, amputation, TBI, you'll have post-op, post-neurosurgical cases. So we get a lot of I guess, like back and forth between many of the different services on the inpatient unit. Many complex cases, a lot of unique pathologies, rare cases. You would see cancer rehab, transplant patients. We get a lot of those life vest patients, people who are going back and forth between surgery. Sometimes people even who are undergoing chemo or radiation therapies. We just see a lot of the more unique cases. Meyer 7, sometimes VIP patients, special patients. So a lot of unique cases there. Then we have Bayview, which is also inpatient rehab. That's more bread and butter cases. You'll see your general strokes, amputees, orthopedic neurosurgery cases again. But it's if you had Meyer 7 as a very, I guess, medically complex patient, then right underneath that would be Bayview, where it's a little bit more typical PM&R. These are about 3 to 4 months per location in your PGY2. Then we have 1 to 2 months of spinal cord injury at University of Maryland. And most of those would be traumatic spinal cord injury. However, you could see a variety there. And in 1 month of consults, whether it's stroke consults or general consults, and on general, you would see the variety of amputee, ortho, and other specific consult questions. We see a lot of spasticity consults, pain consults. There's outpatient rehabilitation clinics. You have 1, 2, 3 months of that 1 year in PGY2, and then additionally a research month in your PGY2 where you can participate in any research going on in the department, starting your own project. We really encourage a lot of the residents to get something going that they can present at the annual research expo once throughout their residency. Then for PGY3, that's when we do our inpatient peds rotation at Kennedy Krieger. We also have a selective month, which is 1 to 2 months that you can spread between your PGY3 and your PGY4. You have 3 months in total that you can kind of move around, and that's very flexible if you want to do an away rotation somewhere, if you want to get a little bit more exposure in something in particular, if you would like to do lifestyle medicine, which we also have an option for double board certification. There's a lot of flexibility that you can start building into your schedule, PGY3 and into 4. Consults for 1 month. So if you did stroke, you do the general consults, etc., get a little bit more exposure to that. Then you become a senior. So you have a senior month at either Meyer 7 or Bayview, and you do 8 months or so of the outpatient clinics. We have general rehab, sports, MSK and spine, pain, prosthetics and orthotics, pediatrics, and outpatient SCI, which is also at KKI, which is Kennedy Krieger. And then we also have a subacute rehab rotation for 1 month, which can be done in PGY3 or PGY4. And then we go into PGY4, we do 3 months of EMG, so we got a lot more EMG hands-on exposure then. We have 1 to 2 months of consults, and again, senior month again, either at Meyer 7 or Bayview. We have traumatic brain injury at University of Maryland, more outpatient, and another selective month. So there is a lot of create your own learning, a lot of more figuring out your own schedule, what you'd like to do, which is great if you have in mind something that you want to work towards in terms of your career. So a day in the life at Meyer 7, we have 18 beds at Meyer 7. Our EMR is Epic. The team structure at Meyer 7 is generally 1 attending, 2 PGY2 junior residents. Those will be the primary providers. You have 1 senior who oversees them, and that's primarily for teaching as well as helping out, and 1 nurse practitioner, and that's Minnie. She works at Meyer 7. So the day starts at 7:45 to 8 a.m. You get sign up from the overnight on-call resident. Usually it's through a Epic chat sign out. There's no need to pre-round before. Most of the sign up that we also get from the charge nurse will tell us what happened overnight. And then we'll do bedside rounding, whether that's with the attending or on our own, and then kind of coming together with the plan. At 11 a.m., we have our multidisciplinary team rounds with neuropsych, nutrition, therapy, nursing, social work. In the afternoon, it's finishing up your notes, working on admissions, finishing up orders, managing the patients as usual. We have sometimes teaching that goes on with senior residents or attendings. We'll go through either a topic in particular or some research articles. And then sometimes we like to do a little activity all together. There's Wellness Wednesday, where they have a wellness activity that goes on in the hospital for all the residents. Sometimes they have snacks, sometimes they have food, sometimes they have therapy dogs they can pet. There's also the Rise Room where we can go and relax with like massage chairs. You just book the time in advance. So we kind of like to spread out our afternoons if we have some downtime. And then at 6 p.m., you just sign out for the overnight call, when we'll go into the call schedule in a little bit. Then we go over to Bayview. So Bayview has two different teams. There's Team A and Team B. Team A has 17 beds. Team B has 16 beds. Team A is similar to Team B as they're both one attending, one mid-level, and one PGY2. And then you have a senior that kind of oversees both Team A and Team B all together. And there's two meetings, a huddle meeting and a team meeting for both Team A and Team B. So the typical day works where you have an 8 a.m. sign out from the overnight call resident, you pre-chart, and then you can be ready to round. Between 8 to 12, you attend your huddle and team meetings, you do bedside rounds, and in the afternoon, similarly, finishing up progress notes, working on admissions and discharges, teaching. There's also a Wellness Wednesday at Bayview, and then a 6 p.m. sign out to the R1 resident who's on call. So we do have didactics. It's mentioning that for just finishing the progress notes. So we have didactics. The notes are taken care of by the PA and the attending who are on for that day. So the way that our call schedule works is that we have an R1, R2, and R3 call. R1 is in-house 24 hours, and they get a post-call day. They cover the Bayview and Meyer 7 inpatient units, both of the units, from 6 p.m. till 8 a.m. So you do your regular rotation during the daytime, and then at 6 p.m. you have to be at Bayview in-house, and then you cover both of the units. We're responsible for late admissions at both of the locations. And then on the weekend, if your R1 days on a weekend, you round at Bayview inpatient, and then you do your 24 hours there. R2 is a home and backup call, which is 1 week long. You have a backup to the R1 resident for emergencies. So during the week, if they have anything where they have an event going on at Bayview and they need someone to go at Meyer and see something going on there, they can call the R2 resident and say, hey, I need help. Can you go see the other hospital because I'm taking care of something here? And that's the way we cover both if things happen at both places, but usually it's not like that. Usually the R2 resident has a pretty nice sleep overnight. And on the weekend, while you're on your R2 week, you round at Meyer 7 during the day, and then you sign out overnight to the R1 who's at Bayview. So you work both Saturday and Sunday during the daytime, but most of the time we tend to finish rounding and seeing all the consults and writing all of our notes. The earliest someone could leave is probably be around like 12 to 1, and then it can go all the way up until 6 p.m. sign out, just depending on how busy Meyer 7 would be. But there's also an R3 system. So in case someone gets sick, in case emergencies happen, a weekend, something goes wrong and someone needs to leave, we have a Jeopardy/backup call that it's usually a PGY 4, 3 or 4, and they hang around that weekend around Baltimore or around the area, and they're available to come in if need be. I guess I didn't mention on that side, we have approximately, I think the PGY2s have about like 27 to 28 R1s, and then 14 to 16 R2s. And then the PGY3s have about 16 to 17 R1s and about 30 R2s. And the PGY4s have no R1s and R2s, but we have R3s. So it gets better the more senior you become in the program, which is nice. So then next we go into vacation and conference days. We have about 15 vacation days per year, and you have 5 additional CME conference days. We also have a special winter holiday work schedule where you have 5 days on and the other 10 days you have off. It's just between the 14 days how it's split. You can't roll over any of those days year to year. And there's also educational stipends, which we could use for those conferences, use for if we want textbooks, resources, etc. And additional money, which is unique for publications, So it's encouraged to have a lot of research and publish, so you get a little bit more funds to your education stipends. And also, if you're not on call on holidays, we get the other holidays off, which is really nice to be able to plan ahead to spend time with family. Then we have our Tuesday didactics. They're 8 to 1 is protected time. And we have lectures by attendings, residents, fellows, guest speakers. We have journal clubs, ultrasound teaching, board study sessions. And we go over all of those topics that are usually found in our board reviews books. But every fifth Tuesday, we have a field trip, which is really fun. These are some pictures of some of the places we've been to. We've done adaptive rock climbing, adaptive sailing, adaptive horseback riding. We've looked at some of the therapy equipment. This past July, we did assistive technology. And then we also have meals during the months during the rounds as well with PD rounds with Dr. Friedlander. We also have our ultrasound curriculum, which is pretty new. It kind of goes through the machines on the inpatient outpatient units. We get to practice our hands-on skills. And then we meet with some of the fellows so we can have more of that hands-on exposure and learn from the attendings and residents who lead the sessions itself.
You guys have about 2 minutes remaining.
Thank you. Some other highlights is we have a longitudinal EMG curriculum, which we're using to help increase the amount of EMG exposure and learning that we have. We have a continuity clinic. So we do see some patients over time consistently, and we're able to have that senior to junior teaching in the continuity clinics where we do a lot of our procedures, whether it's Botox, joint injections, trigger points, etc. Lifestyle medicine, which I touched on briefly, which is a double board certification option. We have research is plenty and a ton, and also some sports medicine opportunities with sideline coverage and volunteer opportunities. A lot of our residents do go on to fellowship, so this is just a bit of a list of some of the places that people have matched recently, which is, I guess, primarily pain and sports is a good amount of them, but we do have some brain injury and pediatrics. Those are the more popular fellowships that people do go into, and a lot of people do go general rehab as well. So Hopkins, it's a great atmosphere. We have a lot of camaraderie. It's a very underrated city. I'd say there's a lot of things to do, and I only knew that by coming here to Baltimore. There's a lot of learning opportunities, flexibilities, and really a good amount of tailoring your career to however you like. And it's a pretty world-renowned hospital, so you have a lot of resources at your disposal. If you have any questions, you could reach out to our email. Thank you, and we'll take any questions now.
Thank you so much. Yeah, so if you guys have any questions, feel free to either put them in the chat or say them out loud. I think we have 2 questions in the chat. I can read the first one. It says, from your perspective, how holistic is this program when reviewing applicants?
And Melissa, I think I can jump in and kind of answer. I see a couple of the questions in the chat. So in terms of the holistic reviewing, I think so as chiefs, we're not as involved in the initial review. We will do some of the interviews, but from what we've heard from our program leadership, they do a pretty holistic review of all of the applicants. I know all of the programs are getting a ton of applicants, but we want to make sure that, we're really screening for people who match with our program values, bring diversity and different experiences to the program. And so the leadership, I think, does a really good job of trying to do a really good holistic review of all of the applications that we get. And then in terms of the IMG and visa, we do have a couple of international IMG residents now in our program. So I do think that we are supportive of that. I know the current PGY3 class has one, and then the newly matched class also has another. So I think that overall Hopkins is very supportive of IMG and supporting, I'm not sure which visa, I think it's the H1, but I think they do support the visas.
Favorite Baltimore food place? I'd say Kababi is a favorite from all of our residents. We tend to order from there a lot, and Ekiben. Ekiben's also pretty popular amongst all of us. We tend to go there, unless you guys have some other places you want to recommend.
No, I think actually Baltimore is kind of secretly a foodie place. One of our attendings, Dr. Mayer, is like a huge foodie, so he always has the best food recommendations. A lot of the like restaurants are like kind of row home, really small types of places, and they're all like very unique cuisine. So I was actually pretty surprised with the amount of food options that Baltimore has. But yeah, Ekiben is excellent.
It is, and they also have like a restaurant week where they have lots of deals on the restaurants. And Melissa, I know you love that one every year.
Great, thank you guys so much.